Hi everyone, my name is Noel Horwin and welcome to Life in California. Today we're going to be discussing a great issue before all of us, healthcare reform in America. It has impacted all of us, our families, our government, our businesses, our school systems, etc., etc., etc. The question is, do we have a solution? Our guest today, Dr. Barnett Meltzer, believes that there is. Dr. Barnett Meltzer is a nationally renowned expert in preventive medicine and integrative medicine. He has been a primary care physician for 40 years, board certified in the state of California, and he has some distinctive views about this entire issue. That being said, welcome Dr. Barnett Meltzer.
Noel, thank you very much. My pleasure.
Doctor, could you give us your take on the health care reform crisis in America?
Well, Noel, let me say it's great to be here. Always a pleasure to be on your show. And, you know, the fact of the matter is we do have a crisis right now. At one time it was a predicament, but now it's a crisis. And to get it simplified for your listeners, the healthcare crisis comes down to two very simple issues. The first is the cost of healthcare, and the second is the quality of healthcare. Here's what my concern is. The cost of healthcare is spiraling upwards. It's trending upwards. And at the same time the cost of healthcare is going up, the quality of our health is going down. We have more childhood obesity. We have more adult obesity. Why in my practice over the last 10 to 20 years, I see more folks overweight, stressed out, and burnt out than ever. So that's my concern. That's why I think it's a crisis. And at the very same time, what's interesting is we have the best political minds working 24/7 around the clock to see what they can do about solving this healthcare crisis. I was kind of, very interested in hearing President Obama's comments when he said that he wasn't the first president to take on healthcare reform, but he hopes he'll be the last.
How does the current healthcare reform measure up?
We all want the same. In other words, we want to have affordability, meaning we want to have healthcare costs to come down. We want to have adequacy. We want to upgrade the quality of healthcare. And we want to have availability, accessibility. We'd like to have all Americans have availability to healthcare. That's the good news. In other words, there's a good news and bad news. The good news is that President Obama has the right objectives and the right goals. The bad news is this. The current approach to healthcare reform, President Obama's program right now, is misleading. It will not address the problem. It will not solve the healthcare crisis. In other words, restructuring insurance companies won't solve the problem. Having a public health option won't solve the problem. Having a new insurance exchange where people that have small businesses and individuals that don't have insurance would get new insurance is not going to solve the problem. Cutting back on the cost of drugs is not going to solve the problem. Improving hospital care is not going to solve the problem. And reducing physicians' fees is not going to solve the problem. Now, these are important measures, but they're not going to solve the problem. The point is that unless we address the root cause of this inflationary stress in terms of the healthcare costs and the quality of care, if we don't address the root cause, we're not going to solve the problem. In other words, to me, the president's approach is downstream, not upstream. It reminds me, for example, of the approach you would take to having wounded bodies floating down the river. The president and his policies are concerned about how to take care of the wounded bodies down the river, but they're not figuring out upstream how the bodies get into the river. In other words, the current policies approach is reactive, not proactive. It's downstream, it's not upstream, and in fact, it's micromanaging, it's not looking at the big picture. The big picture to solve healthcare reform, what the people need to know is that unless we address the root cause of the healthcare problem, it's not going to get solved.
Dr. Meltzer, what is the root cause of the healthcare crisis in America, and what is the solution?
No, I'm going to start with the solution. The solution is preventive medicine, the wave of the future. You know, I have a motto I share with my patients, kind of a theme we talk about that helps them understand how this is going to work. And here's the motto. The least costly illness, once you understand this, you really get where I'm coming from. The least costly illness, mind you, the least costly illness is the one that never occurs. What happens in our society is that unfortunately 4 to 5 Americans 65 or older are suffering with one form or another of a chronic illness. It could be arthritis, it could be diabetes, it could be heart disease, it could be stroke, it could be high blood pressure, it could be Parkinson's, it could be Alzheimer's, it could be metastatic cancer. But the reason we're having a healthcare crisis in terms of cost is that every year some $1.5 trillion now is being spent because 75% of our healthcare dollars goes to paying for chronic illness. Now the truth is the majority of these chronic illnesses can be prevented. In other words, we have scientific evidence and evidence-based research, empirical evidence from years of my practice that we've observed that people's lifestyles, their habits, their choices have a huge impact on their health. For example, someone who smokes and doesn't exercise and overeats is unlikely to maintain good health. So we know there's a connection between lifestyle and choices and well-being, and we want to make sure individuals are empowered to do something about this. But the answer is preventive medicine, and the cause of the problem is the cost of chronic illness.
Dr. Meltzer, you've said now that the root cause of this whole major crisis, health crisis, is chronic disease, and that it represents 75% of the medical costs in this country. And for the most part, this chronic disease can be prevented.
That's correct. And to make matters worse, we have an aging population. And it's estimated that over the next 20 years, the number of individuals over 65 will increase by 50%. So we're going to have an increase in chronic illness. So this is my concern. The President and myself and all those concerned are looking for long-term solutions. But what are we doing about the primary cause, which is the escalation of chronic illness and the cost of chronic illness?
So Dr. Meltzer, if I understand you correctly, any healthcare reform that does not include as a centerpiece taking care of the chronic disease in this country is misguided and will not be a sustainable solution for healthcare reform.
That's correct. We could throw everything else out. By focusing our attention, by putting our nation's efforts on preventing chronic illness, a great majority of which can be prevented, we would be making a huge impact in healthcare costs. Now, I'm not talking 1%, I'm not talking 2%, I'm not talking 3%. I'm talking 30%, 40%, 50%. Let me give you some very attainable goals. For example, let's say instead of having 2 out of 3 Americans overweight, we just had 1 out of 3 that were overweight. And let's say, for example, instead of having 4 out of 5 Americans aged 65 or older suffering with a chronic illness, we only had 2 out of 5 Americans having chronic illnesses. We could save something like $800 billion a year. And the future is preventive medicine, empowering people, empowering the individual, not empowering disease, empowering individuals to be well, empowering people to stay well, empowering families to work together to stay well, to educate people on the tools and the resources of being well. That's the future. That's the way to prevent disease. That's the way to solve the healthcare crisis in our country today.